What's going on, everybody? Tyler Brown here with FutureDDS.
Tyrell Friday here with FutureDDS.
And today we are here to talk about what it's like being in clinic during COVID.
Let's go. If you're a newcomer to the channel, what Tyler and myself do, we put out these videos to help pre-dents get into school, as well as show a little bit of what the dental school experience is like. So if you haven't already, make sure you hit that like button, the subscribe button, and the notification bell so you know whenever we post up new videos.
So COVID has been rough, for everybody. It's been a hard time. It's been a hard time. Here in dental school, we haven't spent that much time in school, actually. Unfortunately, COVID happened during our primary months within clinic, so that means that we are not seeing as many patients as we expected to originally.
Right.
But it's okay. I think that, granted, nobody knew, this was gonna happen. Nobody knew the situation would come about. So we definitely are trying to make the best of it.
And we're back.
And we're back.
So,
keeping our spirits high, because that's all we can do. But we want to kind of talk to you all about things that have changed now that we are returning back to clinic. Just the differences between now and pre-COVID.
All right, so first thing is probably the biggest change, and that's the limited clinic seats available. So most dental schools weren't really equipped with positive pressure or segregated seats or chairs in the dental clinic. So it's going to be hard, or schools had to make modifications just for sake of social distancing and keeping the patients safe, keeping the students safe, and kind of limiting interactions amongst all the people that are going to be in the dental school. So there are a lot of things that had to be changed, from scheduling patients to to making sure that students are getting enough chairs, and making sure that students are getting equal amounts of exposure to the patients that are coming in and the procedures that are coming in. So that's one big change that I've seen, or that we've seen so far since clinic has started back up, as well as just the overall process of coming into school and having to make sure you're following COVID protocol, getting COVID tests. Like, there's a lot of things that have changed, and it's for the better. It's to make sure that we're staying safe and make sure that we're following all protocol to make sure we're giving high quality care to our patients.
No, definitely. And in regards to keeping everybody safe, I guess I'll kind of talk about the attire a little bit. So right when we walk into school, we literally have to change. Yep. So if I walk into school with these scrubs, I'll go up to the second floor and I'll literally change into fresh scrubs that the school provides us. Which is, it's great. It's cool. I like my scrubs. I like have my name on my scrubs, but it's not that big of a deal. But then once we go upstairs, we have to go through what we call a donning process. And so basically what that is us putting covers over our feet, us putting on a lab gown, us getting a N95 mask, and keep in mind, throughout each step, we're washing our hands. Yep. Then us putting on the eyeglasses, and then us putting on the face shield, a hair bonnet, everything. Head to toe, and it's hot. It's hot in that thing. It's smoking, but of course, like Tyrell said, the school's doing that just to make sure that we're not putting our patients or ourselves at risk.
So again, just to speak back to a little bit on the scheduling aspect of seeing patients in clinic, when we first got back to clinic, we weren't scheduling our patients at all. It was kind of like, come to clinic, you're going to be doing this day, this is what you're going to be seeing, get the case, and kind of we're going to talk about it before you go in and go through all of that. Now we're now getting our personal rosters back, and we're able to see our own patients again and bring them in for some procedures that they need. As well as, we have a master list now, so that now if Tyler needs a patient to come in during a certain time slot, or some of his patients don't want to come in or don't feel comfortable coming in, or whatever the case is, if he needs something, he can contact me. Just figure out, hey, can you contact this patient? Can you reach out to this patient? And he can see that patient. So the system is definitely changing for the better, just to make sure that, again, everybody is making sure that the patients that need the care right now, and more immediate care, are getting taken care of, as well as people, the students are getting the exposure that they need, especially heading into, our last year of dental school. So
another thing that's changed, and granted, this isn't directly involved with our clinic, but it's still involving clinical exposure. So basically, we've talked about a externship that our school provides every year. And initially, we thought that program would be canceled, but it wasn't. The great thing about it was we were able to still have the opportunity to go to some of the sites. And of course, I think there was, of course, a limited number of spots. I think that there was about 50 spots for about 150 students who said they were interested. Unfortunately, neither of us were chosen, but it's all good.
They won the lottery.
At least some people are going to be able to get that experience working,
For sure.
in an outside environment. Of course, with all PPE, whatever they need.
Sure.
It would have been a great experience, but at least, like we said, some of our colleagues would be able to still experience it.
And hey, if things open up a little bit more, we might more sites might get opened up in the spring, and we might be able to get more students to go out. So hoping for the best.
Yep.
Another big change is the availability of the sim plan and the pre-plan. So usually the sim plan or the pre-plan is pretty open for us to go in there and just practice if you want to work on a certain prep, or just go in and just do anything, honestly. If you want to work on endo, if you want to work on a crown, if you just want to go in there and work on some operative, like whatever you wanted to do, it was pretty available to you. But now, because of the social distancing, and because our class has to be split up, doing workshops and different things of that nature, those locations are kind of limited for access these days. So, for CDCA, of course, they were more wide open so that we can get in there and make sure we're getting our practice and make sure that we're competent, our hand skills are up for those exams. But when there's workshops during the day, say there's a post-core workshop, or say there's a pros, or a operative class 3 workshop, like we don't have that availability as much. So that's a little change. You definitely got to find your spots to get in there and get some work done. But it again is for the better, and just making sure that we're staying safe as possible through this time, honestly.
So one of the positives within the situation is the fact that because we are allowed to only have a certain amount of people within the clinic at a certain time, we are granted the opportunity to work one-on-one with professors instead of, back in the day when there might have been one professor for every 4 students.
Yep.
So that really gives us an opportunity, even though we have less of them, it gives us an opportunity to go deeper with the doctors who are actually helping us out with these procedures, and really ask them all those nitpicky questions that we might have. And I think that's been, in a weird way, with them being right by our side, one appointment kind of equivalates to maybe 3.
I say 3. I say 3. Because usually, okay, so a typical day is a 3-hour appointment. But if say it's a typical day, a pros faculty is working with 3 students, that means you pretty much get an hour a day. Typically maybe, and that's that's a 3-hour appointment where you're setting up, the patient's coming in, you're taking, you're doing EHRs, you're doing all this stuff, and then at the end you're doing case notes, cleaning up. So realistically, you're getting 2 hours of work time. So when in this situation where you're getting 2 to 3 hours of work time, but it's solely, hands-on focused training, versus before, you might get 30 minutes of actual hands-on. I'm sitting with you doing this procedure. Okay, do this. I'll come back and check. Okay, you're good. So, especially those first-time procedures, stuff like that, it's definitely helpful. It's definitely a tool, and you can ask those important questions right then on the spot instead of having to remember okay, am I doing this right? Can you check this? But also this, and forget that question maybe. Tell you a trick right then on the spot, feeling on the tooth and explore, different things like that. Oh, doing an occlusal test versus, trying to do a putty. Do different things here and there where you can actually learn and benefit a lot more. Pick up those little tricks that you're looking to pick up when you go into private practice, or, start working. So,
like we said before, it's not ideal, but we are making the best out of the situation. Everybody's going through it right now, so what we can do is come together as a dental community and really just continue to support each other. And I think, via Facebook groups and all these different apps, we're able to do so. So Thank you all for watching again. If you all ever have any questions for us, you can always shoot us a DM on Instagram at _FutureDDS. If you haven't already, make sure you hit the subscribe button below and also hit the notification bell for whenever we post new content. And we have something new coming on the way, so definitely stay tuned for that. But all right, y'all.
All right, y'all.